Okay, I think it is exactly the hour that we are to start. And it's good evening, everyone here from Washington, and good morning to those of you who are joining us from Asia. I'm really delighted to welcome you here because this is the CTR in Public Health. It's the third workshop, as you know, of a three-part series, which is examining cooperative solutions for North Korean denuclearization. And my name is Angela KANE. I'm the current Sam Nunn Distinguished Fellow at the Nuclear Threat Initiative, and I'm also the moderator for today's session. And maybe those of you who have been at the previous two workshops already know the module that we're following. And it is our hope that these workshops, which are sponsored by the South Korean Ministry of Unification and the MacArthur Foundation, also supported by the Nuclear Threat Initiative, will contribute to really a new approach or a renewed diplomatic approach to North Korea through the realization of a cooperative threat reduction plus initiative. And we're calling it plus initiative because it is, of course, not the original, but we are hoping that we will contribute more to it. And a reminder of those to address really serious security challenges in our region and have a particular focus on non-proliferation, on risk reduction, and also on disarmament. And I'm not a network member. In fact, I'm a network member of the European Leadership Program, but having lived 6 years in Asia, I have cooperated greatly with the APLN, and I'm always delighted to meet my friends and the senior leaders there, like Chung In-moon, Gareth Evans, Ramesh Thakur, Shata Shetty, who is here with us today, and also Marty Natalegawa, who was in the previous workshop. Now, what are the aims of these workshops? It's really to assess ways in which we can adapt and tailor the cooperative threat reduction program to the very specific and very unique circumstances of North Korea. And you may know that the original CTR program, which was created by Senator Nunn and the late Senator Richard Lugar, offered financial and technical assistance and expertise and helped really secure and dismantle weapons of mass destruction in the former Soviet states after the end of the Cold War. And that was a very important initiative, and it is our hope that this could be looked at in terms of does it have any applicability to the current circumstances on the Korean Peninsula. Now, the purpose of the program is to really explore the viability of a CTR program adapted to the unique circumstances in the DPRK to facilitate engagement in critical sectors and of their economy, space. And we had last couple of days ago, we had the energy that we looked at, and now today, public health, to open the door for diplomacy and lay the groundwork for denuclearization. We have a wonderful team of presenters here today. We're starting with the Dr. Jong-koo Lee, who will deliver his opening remarks for the session. And I should tell you that he will present his material in Korean, but there is a interpretation facility. So if you click on the bottom of the screen, you will see it and you can hear the presentation interpreted right away into English. And I should say that Professor Lee is the former director of the Korea Center for Disease Control and Prevention, where he served from 2007 to 2011. And he developed various programs and systems for primary healthcare and also renewed public health programs in South Korea. And currently he is a professor of family medicine at Seoul National University's College of Medicine, where he teaches and conducts research on primary healthcare, public health policies on global health, and infectious epidemiology. And now, without further ado, let me welcome Professor Lee. Please go ahead.
Thank you for your nice introduction. Today, I say about the current response and the global alliance, the ROK, against COVID-19. I'm sorry, I speak to the Korean. I apologize to all of you.
I apologize, but I will conduct my presentation in Korean. So as I mentioned, the title of my presentation is Current Response and Global Alliance of ROK for COVID-19. So you can see globally, the confirmed cases are over 231 million and death is over 4.7 million, but excess mortality is presumed to be at 3 million. And so if you look around the world, we see that the third wave of the pandemic has actually gone down. And if you look at Asia, we see that there is an increase, especially in deaths. And in the Northeast Asian region, Russia and Mongolia, we see notable increases in the death toll. So last year, WHO announced the public health emergency of international concern, PEG. And there are 4 criteria for declaring PEG. So is it unexpected? Is it unusual? Is it significant risk for international spread? Is there a significant risk for international travel or trade restrictions? So you can see the 4 criteria. And after Ebola broke out in 2014, the World Health Emergency Program was launched. And currently, Mark Ryan is the director of the World Health Emergency Program. So WHO has enhanced surveillance of countries and also is sharing information with the countries. And they are making short-term and long-term recommendations. They are assisting the different countries. And they are also trying to see if countries abide by IHR. But many countries this time around under the COVID-19 pandemic have not been able to follow the obligations under IHR. So the WHO recommendations are proposing to not close borders, but to look at alternative measures, such, for example, for persons, you can see here, medical exam, vaccination, contact tracing, isolation, exit screening. But countries wanting to protect their own citizens did actually close off their borders against the recommendation of WHO. Korea is seeing the 4th wave of outbreak. You can see that there are on every day about 1,800 cases, and these are people who have not been vaccinated or who have been only partially vaccinated. And we see the greatest number of confirmed cases in the age group of 20 to 39. So there's a higher group of young people who have not been vaccinated today. So this actually has led us to come to a situation where we have been able to control the mortality rate. And up until now, we have been able to up until now, we have been very successful in contact tracing. But these days, we see a lot of hidden confirmed cases. And also there is the Delta variant. So the transmission of the virus is very fast. And so all of this has led to the 4th wave of outbreak here in Korea. If you look at Korea, contact tracing, targeted tracing, testing, quarantine, isolation, these have been the key to Korea's measures to control COVID-19. MPIs, there's been a few protocols that have been implemented, wearing face mask protocols, washing hand protocol, etiquette of coughing protocol, as well as social distance protocols. And even when you do have social distancing, in Korea, we did not actually go to that phase of full lockdown and shutdown, but we did restrict people's personal gathering. So here you can see the vaccination rate of countries around the world, and vaccination rates are going up. You can see that 74% in Korea have received their first jab and 45% have completed their vaccination. So we can see that inoculation rates are going up, and what we find is that in UK and US, we see a further increase in infection cases, even though inoculation rates have gone up. And so this has has created a very tricky political situation. You have to choose between human rights, find a balance between human rights, economic development, and also managing the spread of COVID-19 pandemic. But if you look at UK and the United States, they have been able to lift restrictions because they have actually seen a decline in mortality rate. So if you look at Korean MPI, I think that Singapore has a very high vaccination rate, but they've seen an increase in confirmed cases. So Korea has increased MPI. So compared to Singapore, I think the confirmed cases are lower, relatively speaking. So people in Korea feel that we have too many restrictions in place. But you can see that for Korea, it is within 45 points, and the UK is at 42 points. So you can see that the MPI is not so strong or stringent here in Korea. If you look at the impact of COVID-19, it has increased the number of death toll around the world. And while treating people who are in the hospital or people who have been in confirmed cases, we have not been able to capture the deaths that have occurred at the nursing homes or outside of the homes. And a lot of the deaths that took place outside of the hospital was due to disruption in health service delivery, lack of routine immunizations, or people who had restricted access to healthcare services. And because so much resources going into COVID, there was a shortage of funding for non-COVID-19 services. And all of this has led to increase in excess mortality. WHO surveyed countries around the world, and the DPRK was included. And so I would like to share the results of this survey, which will give us a good idea of what is happening around the world. But the number of countries that responded to the survey was 135 countries, and 94% of responding countries experienced a disruption to some extent. And you can say that 9% of countries reported disruptions in 75 to 100% of services. And you can see for the other categories, it's around 20 to 30%. Only 6% of countries reported no disruptions at all. So if you look at service disruptions, you can see that cancer screening and treatment services have been mostly disrupted, and treatment for hypertension, diabetes, and asthma has also been disrupted, as well as time-sensitive services. So this May, there was the WHO assembly that was convened, and DPRK shared what was happening in their country. So they had a pan-ministerial emergency system in place, and they provided surveillance guidelines to hospital doctors and relevant officials. But in terms of the accuracy of their diagnostic tests, in terms of biosecurity at their laboratory, and also in terms of technological and resource support, these are areas where they need improvements. I think what this says to us is that these are the areas where we can cooperate with North Korea. North Korea has been doing a good job of managing zoonotic diseases, but in terms of laboratory safety and in other areas, you can see that there needs to be more international cooperation because they lack stable supply of food and there's no real data regarding the quarantine centers. The WHO Secretary General said that because of vaccination programs, a lot of countries are monopolizing vaccine, and he is saying that a few countries are dominating or monopolizing 75% of all the vaccine. And he was talking about vaccine injustice and how we shouldn't have booster jabs, but we should actually allocate the vaccines to the low-income countries. But of course, that is not the only solution. In terms of diagnostics, therapeutics, vaccines, and health systems, we need to accelerate these different components of the healthcare delivery system, and this does not happen overnight. So if you look at WHO, through COVAX, they are trying to provide vaccine to the low-income countries, but the issue at hand is that in terms of scaling up vaccination development, the model that we have in place is the hub and spoke model. So hub model is looking at mRNA vaccines. So the companies that can manufacture mRNA vaccines under the supervision of WHO would transfer their proper IPR and produce the mRNA vaccines. So I think Korea can play a role. So Korea basically has been producing medical products through CMO. So Samsung has been producing Moderna, SK Bioscience has been producing AstraZeneca, Korea Chorus has been producing Sputnik, and SK Bioscience also has been producing Novavax. And so the storage of these vaccines, the production of these vaccines could take place here in Korea. So Korea is in a good position to become a hub of Northeast Asia. So the Korean government needs to increase its efforts. And also WHO has hubs in Latin America and Africa region. And I think that if Korea becomes a hub of vaccine production in Northeast Asia, we would be in a position to more smoothly or more effectively support DPRK. So in Sector 1, quarantine, contact tracing, and tasting is something that we are very good at. In Sector 2, you have patient care and also training of human resources. You have the development of vaccine materials, vaccine vectors, and then you can also develop hardware such as ventilators. And all of this could take place here in Korea, and we could become a hub of these activities in Northeast Asia, allowing us to assist DPRK. So there is an international vaccine institution called IVI. And so we could also contribute to the activities of IVI as well. So Korea could play a significant role in these areas. And with close cooperation with North Korea, we can address the COVID-19 pandemic. But I think that in order to open the borders between the two Koreas, we need to have vaccination in place. So North Korea needs vaccines, but how do we offer North Korea these vaccines? I think that is a challenge that the Korean government will need to address. So this is all I have today. Thank you for listening to my presentation.
Sorry, I had to unmute myself. Thank you very much, Professor Lee. That was an excellent introduction to the topic that we're dealing with today, both as you covered the world and also you covered the specific situation on the Korean Peninsula. That was really very good. And we now have another presentation, the first presentation for this session, and this is will be given by Professor SHIN Young-jeon. And he will be presenting the Northeast Asian Public Health Initiative and the DPRK. And I should mention that he is a professor at the Department of Preventive Medicine at Hanyang University.
Thank you, Andrew.
And he's also the chief editor of Health and Social Welfare Review and a board member of the Academy of Critical Health Policy and the Korean Association of Preventive Medicine. And I'd like you to welcome Professor SHIN. And also I should mention, please use the translation or interpretation little clip if you wish to hear it either in English or in Korean, which I think will be the original. Thank you very much. Professor SHIN, over to you, please.
Yeah, thank you, Andrea KANE. Good morning. Good morning and good evening. My name is Young-jeon SHIN. I'm a medical doctor by training and professor at Hanyang University School of Medicine, Seoul, Korea. Yeah, I'm happy to have an opportunity to present here. Yeah, I hope you understand what I'm presenting in Korean today.
So
예,
my presentation is
제가
about North
발표할
Stage of
내용은
Public Health
코비드
Initiative
팬데믹
under
하에서
the
동북아 보건안보
COVID-19
협력체입니다.
I
통칭해서
will call this
North
initiative
East
as
Asian
NEFI.
Public Health Initiative를 NEFI라고 제가
Due to time
말씀드리겠습니다.
constraint, I will make my presentation
아주
very brief.
시간이 없기 때문에
North
아주
Korea is
간략히
facing triple
말씀을
burdens right
드리면
now.
지금 북한은 세
One
가지
is
위험에
very
봉착해
strong
있습니다.
economic
하나는
sanctions against the
매우
DPRK. The
강력하고
second one
오래된
is
그
COVID-19
경제 제재 하에
pandemic,
있고요.
and
그다음 코로나
the third
팬데믹
one is
하에
this
있고
prolonged
또
border closure,
스스로
which
국경을
is
닫은 지
very
거의
close to
2년이 다
becoming
돼
2
가고
years
있는 이
as
세
of now.
가지
And
문제가
because of that,
있습니다.
humanitarian
그래서
crisis
여러
is
가지
taking
그
place
인도주의적
in
문제가
North Korea
발생하고 있다는
as watchers
그
are
소견들이 좀
saying.
보여지고 있습니다. 가장
According to the
최근에
voluntary national
북한이
report
보고한
in
그
the
Voluntary
US,
National Report에 따르면 5세
about
미만 아동의
14%
여전히
of the North Korean
17.4%가 식량
population
부족
under
상태라고
5-year-old are
보고를 하고
suffering from
있습니다.
chronic
남북 관계가 경색되어 있는
hunger.
상황에서
So the President
한국의 문재인
last year
대통령이
has
이
suggested
네피를
NEFI,
작년에
and I think this is a
제안을
very
했습니다.
meaningful
저는 이게 굉장히
initiative.
의미 있는
So let
제안이라고
me just talk
생각하고요.
about
그것이
background,
가지는
progress,
배경,
and
그 다음에
implication and future task of
경과
this
그리고
initiative.
그 의미 또 앞으로의 과제에 대해서
So
간략히 말씀을
I think
드리겠습니다. 우선 코로나
COVID-19
상황에
situation has
대해서는
been
이미 여러
discussed
차례
fully
논의가 됐기
before. So let
때문에
me just be very brief
제가
about this.
이해하는 파악하고 있는 코로나의 상황을 그냥 간단히만
We
말씀드리겠습니다.
believe that North
현재
Korea
제가
is at
판단하는
phase
것은
3
세
right
번째
now.
단계에
Phase
와
1 is
있다.
about
첫 번째
initial response, and
페이즈
phase
때는
2
초기
is
대응이고요. 두
partial
번째는
mitigation.
부분적
And
완화를
starting
했고
from September last
2020년
year,
작년 그
DPRK
9월
is
말부터는
conducting intensive
규칙적인 집중
examination and
검사가
tests
이루어지고
for
있다라고 볼 수
control.
있습니다.
But North
그리고
Korea
이
is not
백신을
entered
통해
this
한 이제
phase
관리
for
체계로는 아직
management phase
진입하지
through
못하고 있는
vaccination.
페이즈 4로 진입하고 있지 못한
The
상황이다 이렇게
details can be
판단하고 있습니다. 그래서
understood
자세한
by
내용은
reading
좀
these
유인물로
slides. So I will just skip these
대체하도록
slides.
하겠습니다.
So this is the current status of
이
DPRK
북한이
based
보고하고
on its own
있는
reports. So
상황에는요,
starting
주로
from September last
말씀드린
year,
바와
it
같이
is
작년도
conducting
9월
regular
말부터
test.
규칙적인
About
검사가
1,400
이루어지고
to
있는데
1,500
주당 약
tests per
1,500건,
week,
1,400에서
according
1,500건
to
정도의
DPRK.
검사가
And what is
이루어지고
interesting
있다라고
is
보고하고
that
있고요. 흥미로운
the
것은
initial
이
phase
초기에는
is
주당
reporting
약
800
800명
suspected
정도의
cases per
의심
week.
환자,
But
suspected
right
case를
now,
보고하고
it has
있는데
changed its
그
word
기준을
to
바꿔서
SARS
최근에는
cases
이
instead
SARS
of
케이스로
COVID.
해서 severe acute respiratory syndrome
Every week, it is
케이스를 보고하고
reporting
있는데
100
역시 주당
suspected
약 한
cases.
100명 정도
Personally, I
전후에
believe
환자가
that
있는 것으로
even though North
보고하고
Korea is
있습니다.
announced
저는
that it has
개인적으로
no
북한이
COVID
현재
patient,
COVID-19 환자가
its
없다고
number of SARS
발표하고
cases
있지만
is
이 그
increasing.
SARS
And I
환자
believe
케이스
that
수가
the
아마
SARS cases
실제
actually
그
refer
코비드
to
환자
COVID-19
수와 좀 유사할
patients.
것이다 이렇게
And if you look at
판단하고
the
있습니다.
overall
전반적으로 검사
status,
상태를 보면 인구
the
규모를
number of
보정했을 때
tests in
북한의
DPRK is just
검사는
1%
그 한국
of the
남한에
testing
비해서 한 100분의 1
conducted in
정도밖에
South Korea.
검사를
And
규칙적으로
rather
있긴
than the
하지만
general
못하고 있고요. 그리고
population, it is just
대부분이
conducting
제너럴
tests
파퓰레이션을
on
대상으로
medical people,
하기보다는
medical
보건
professionals.
일꾼들을
So
대상으로 하는
I think
검사이라서
their
한국과 같은
test
이
system
검사
is
기반
not for
관리
the
체계는
overall
하고 있지 못한 것으로
population.
보입니다.
And
그리고 아까
to
서스펙티드
infect them
케이스를
cases
인구
are
보정을
just
해보면
30%
발생률은
of South
남한에
Korea.
비해서 약 30% 전후가 있는
So
것으로
there is
생각이
controversy
됩니다.
over whether North
실제
Korea
북한에
actually has
코비드
COVID
환자가 있느냐
cases.
없느냐를
But one of
보는
the
가장
picture is that
인상적인
it was
사건
taken
중에
in
하나는
last
작년 7월에
July. There was this
이
National
노병대,
Veterans
그러니까
Convention
National
in
Veterans
last July, and
Convention을
these
열었습니다. 여긴
populations, these
아시다시피
population groups are
노병들은
very
그
vulnerable
코비드-19에
groups.
가장
But this
리스키한
event was taking
그룹이라고 할
place
수가 있습니다.
indoors,
근데
and no
실내에서
one wore
이루어졌고요. 1시간
masks.
넘는
For
행사에
1
아무도
hour
마스크를 쓰지
event,
않았고
김정은
이 자리에
participated
김정은
in this event,
위원장이
and without mask,
참석을
he
했고
made a
상당 시간
speech.
연설을
And 1 year
했습니다.
later,
마스크
in
없이.
July this year,
그리고
they
1년이 지난
hosted
얼마
7th
전에
National
다시
Veterans Convention,
제7차
and
전국
this time
노병대를
they also
개최했는데
didn't
역시
wear
마스크 없이
a
진행이
mask.
되었지만 흥미로운
But this
것은
time
이
the
이번에는
event took place
실외에서 이제
outdoors
진행을
instead of indoors.
했다는
That's the
것입니다.
only difference.
여러
So
가지 유사한
if
사항들을
we look
검토해
at
봤을
the
때
circumstances
북한의 제 개인적으로
surrounding the
북한의 코로나
DPRK,
발생은 있지만
even though
상당
there
부분
are some
관리하에 있는 거
confirmed
아니냐
cases of
이게 이제 제
COVID, they are
판단입니다.
control. They are under tight
4단계의
control
백신을
in
통한 관리는
DPRK.
아시다시피 코백스 퍼실리티가 북한의 약 20%에 해당되는 사람들에 대한 아스트로제네카 또는 그 코백스 백신을 지원하겠다고 했지만 북한이 받아들이지 않고 있습니다. 특별히 최근 9월 초에요. 북한이 발표를 했는데 우린 코백스 퍼실리티에서 제공하는 시노판을 받지 않겠다. 그리고 이거는 다른 필요한 나라에 더 필요한 필요한 나라에 제공했으면 좋겠다라는 의사를 공식적으로 밝혔습니다. 이런 의사는 세 가지 정도의 의미가 있다고 생각하는데 첫 번째는 그 20% 정도만을 제공하는 것은 사실상 별 의미가 없다라고 판단을 한 것 같습니다. 적어도 80% 이상은 제공을 해야 사실은 의미가 있기 때문에 코백스의 20% 정도의 지원은 별 의미가 없다는 판단을 하고 있는 것 같고요. 두 번째는 지금 코백스가 지원하겠다고 하는 그 코백스 그 중국산 백신보다는 뭐 얀센이나 모더나 쪽을 더 선호하고 있는 것으로 보입니다. 또 세 번째는 우리는 이제 문제 끄떡없다, 문제 없다라는 것들을 선전하기 위한 이 세 가지 의도가 있는 것으로 보이고 있습니다. 어쨌든 지금 현재는 그 백신을 통한 그 관리 체계로는 진입하고 있지 못하다 이렇게 볼 수 있습니다. 네피와 관련해서는 최초에 작년 9월에 그 문재인 대통령이 뉴욕 그 유엔 총회에서 이 네피를 제안했고요. 거기에 특별히 중국과 일본, 그다음 몽골리아와 북한의 참여를 제안을 했습니다. 이것이 가지는 의미는 이게 멀티레터럴 코퍼레이션에 대한 제안이었다는 게 좀 참신한 거라고 할 수가 있습니다. 그 배경에는요, 이러한 시도가 이제 상당 부분 다양한 영역에서 이 멀티레터럴 코퍼레이션의 시도가 있어 왔고요. 또 그런 것이 필요하다는 제안들이 전문가들의 제안이 있어 왔습니다. 그리고 이 헬스 섹터가 가장 비정치적인 분야이기 때문에 이 그 남북 경색을 깨는데 굉장히 중요한 수단이 될 수 있다고 판단한 것으로 보이고요. 그다음 말라리아랑 그 조류독감 그리고 아프리칸 스와인 피버 같은 인수공통 감염병 등에서는 남북 모두 협력이 불가피하다는 측면이 있는 것 같고 무엇보다도 그 2018년 그 남북 정상들이 이미 이 감염병과 관련된 협력에 대해서는 합의를 한 것이기 때문에 그 합의를 이행한다는 측면에서 가장 실현성이 높은 아젠다라고 생각을 했을 것으로 보입니다. 또한 북한에서도 이 교육과 이 관광 산업을 다시 활성화시키기 위해서는 이러한 네피와 같은 협력이 불가피하다는 측면이 있는 것 같습니다. 그리고 남북 관계만으로 문제가 좀 안 풀리자 이제 멀티레터럴 어프로치를 또 시도한 측면이 있다고 판단합니다. 현재까지 4번의 그 비디오 컨퍼런스만 있었습니다. 초기에는 일본이 들어오지 않고 미국, 중국, 러시아, 몽골리아만 참석을 했었는데 그 세 번째 컨퍼런스부터는 이제 일본이 참석을 했습니다. 하지만 북한은 아직 참석하지 않고 있고요. 최근에 4번째 비디오 컨퍼런스를 진행했습니다. 다시 올해 그 광복절 그 연설에서 북한에 대해서 문재인 대통령이 다시 한번 네피의 협력을 촉구했고요. 구체적으로 3가지를 협력하자고 했는데 하나는 역시 정보를 나누자, 그 다음에 그 메디컬 쿼런틴 서프라이즈를 공동으로 비축하자, 그 다음에 이제 트레이닝 프로그램을 공동으로 운영하자라는 보다 구체적인 사안들의 협력을 요청했습니다. 하지만 북한의 응답은 없었습니다. 이후에 흥미로운 사건이 몇 가지가 있는데 성김 그 US Special Envoy for North Korea가 2번 한국을 방문했습니다. 그래서 이제 주요 메시지는 어느 곳 어느 시간에든지 북한과 만날 용의가 있다는 얘기가 있었고요. 또 하나 흥미로운 것은 이 The Possibility of Humanitarian Aid에 대한 언급을 주요한 키워드로 언급을 했다는 겁니다. 다시 며칠 전 그 문재인 대통령이 그 유엔 총회에서 이 종전 선언을 하자는 제안을 했고요. 그건 3파티 또는 4파티 종전 선언을 하자는 제안을 했습니다. 그리고 그 제안 중에 또 역시 이 네피를 하자라는 얘기들을 집요하게 다시 제안을 했습니다. 이 문재인 대통령 굉장히 이 네피에 대해서 이제 애정이 있는 것으로 보입니다. 아시다시피 최근 그 김여정 한여정이 두 차례 긍정적인 답변을 내놓았습니다. 그래서 뭐 대화의 가능성을 열어두는 긍정적인 사인이 특히 최근에 이제 있어서 많은 사람들이 또 기대를 하고 있는 상황입니다. 이 네피가 가지는 의미는요, 몇 가지가 있는데 저는 첫 번째로 이 시큐리티 패러다임의 시프트라고 생각합니다. 과거 시큐리티라는 것은 상호 적대적인 패러다임이었는데 이 휴먼 시큐리티는 상호 협력적인 관계를 통해서만 이루어낼 수 있기 때문에 이 시큐리티 개념의 패러다임의 시프트라고 생각하고요. 두 번째는 이 경제 성장이 굉장히 강력한 공중보건 체계의 구축 없이 불가능하다는 것을 이제 확인했고요. 세 번째는 국제적 협력이 불가피하다라는 이런 것들이 확인됐던 것의 결과가 바로 네피였다고 생각이 됩니다. 흥미로운 것은 중요한 사건 중에 하나는 올해 5월 21일 한미 정상회담이 있었습니다. 그 내용 중 합의 내용 중에 상당수가 헬스 시큐리티와 관련된 것인데 남북 정상들은 이 글로벌 헬스 시큐리티 에젠다 GHSA를 강화하고 거기서 한국이 중요한 역할을 하기로 합의를 했습니다. 문제는 이 GHSA가 이 소위 친미 국가들로 구성된 약 43개 친미 국가들로 형성된 New Security Alliance를 지향하고 있다는 것입니다. 전 결론적으로 말하면 저는 이러한 접근에 동의하지 않습니다. 첫 번째 이유는 이 GHSA라는 건 기본적으로 이 건강 문제를 이 폴리티컬 툴이나 웨폰으로 사용하려는 의도가 있다고 보기 때문에 전 적절하지 않다고 판단하고요. 또 하나 많은 나라들과 이 전문가들이 이 미국이 이 그 WHO 체제를 GSA 체제로 전환하거나 또는 WHO를 무력화시키려는 의도에 동의하지 않고 저 역시 동의하지 않습니다. 그리고 현재 GHSA는 그 철저하게 중국과 선진국가들이 배제되고 있는데요. 그럴 경우에 사실은 이 GHSA는 성공할 가능성이 거의 없을 뿐만 아니라 한국 역시도 적극적인 역할을 할 수 없는 것이다. 그래서 저는 이 GHS 접근 방법이 대단히 문제가 있고 그런 면에서 역설적으로 네피 접근이 굉장히 중요한 의미를 가지고 그렇기 때문에 저는 이 북한도 이 네피에는 참여해야 될 이유가 충분히 있다 이렇게 생각합니다. 이 네피가 가지는 한계는 지금 현재는 이 외교부에서 주관하고 있는데 이건 전문성에서 이제 상당히 문제가 있다고 볼 수 있고요. 지금까지의 만남은 그냥 과장급 레벨의 만남이라서 역시 실효성이 적습니다. 그리고 북한이 참여할 만한 그 매력적인 그 큰 재원이나 그 플랜들을 갖고 있지 못하고요. 특별히 북한이 참여하기 위해서는 저는 개인적으로 한 2천만 명 이상 되는 사람의 접종 백신을 제공하거나 그 단계적으로라도 제공할 계획을 제시해야 되는데 그런 안까지를 제시하고 있지는 못하다는 거고요. 그 방식이 조용할수록 아마 이 성공 확률이 높을 것이라고 생각이 됩니다. 그리고 현재 그 차이나와 러시아와 몽골리아의 역할이 굉장히 중요한데 어떻게 하면 이들이 적극적으로 이 네피에서 역할을 할 수 있게 할 것이냐가 또 과제라고 생각이 됩니다. 또 하나는 이제 기존의 인터내셔널 오거나이제이션 역할하고 이게 어떻게 관계를 맺을 것인가 이런 문제를 푸는 것이 이제 매우 중요한 과제로 남아 있다고 생각이 됩니다. 이상 발표를 마치도록 하겠습니다. 감사합니다.
Thank you very much, Professor Shin. That was really an excellent presentation and very topical also. Oops. And I wanted to thank you for that. And you really updated it even with events that were just a couple of days ago with the reactions from North Korea to President Moon's speech as well. So thank you for that. And I also appreciate that you pointed out the limitations of both the NEFI initiative as well as the Global Health Security Initiative. So that was very good for our subsequent discussion. Now we have another presenter, and I would like you to welcome Professor Park Sang-min, and Professor Park will speak on the DPRK's COVID-19 outbreak and its public health sector priorities and also resource requirements. Professor Park is a professor at the Department of Biomedical Science as well as at the Department of Family Medicine, the Seoul National University's College of Medicine. And I would like you to welcome with me Professor Park Sang-min. And I believe he also will speak in Korean, so please employ the interpretation button. We have excellent interpreters who are doing the work. Thank you. Professor Park.
Thank you for your excellent introduction, Angela. And I will give a presentation in Korean.
So going through the
보건안보뿐만 아니라
COVID-19
건강안보가
pandemic,
건강을
DPRK has
유지하는데
recognized that
매우
not only
중요한
defense security, but
사안이라는
health
것을 잘
security
알고
is
있습니다.
critical in sustaining the regime.
특히 북한의 입장에서는 건강안보는
From the
시대
perspective
안정하고도
of
직결이
North
되고
Korea,
또
health
부족한
security is
보건의료
directly
지원을
connected to
국제사회에
regime
지원받는 중요한
stability,
창구가
and international
예방접종을
organizations
담당하는
that
세계
promote
백신연합이나
health
또는
security,
전략
such as
말라리아 등을
Gavi,
담당하는
which is in
글로벌
charge of
펀드와 같이
vaccination and
건강안보와 관련된
immunization of
기구이기 때문에
infectious disease,
더욱더
and the
중요하다고 할
Global
수가
Fund, which
있습니다.
helps to fight TB and malaria, are highly
제
significant,
발표는 아래와 같은
as
세 가지
they
주제를
are important
가지고
windows for
말씀을
securing
드리도록
healthcare
하겠습니다.
funding from the international community, which the
먼저
DPRK lacks.
첫
So
번째
as I mentioned,
탑픽은
there are three parts to my
북한의 코비드 19의
presentation. The
리스폰스,
first part
신영전
is impact of
교수님께서
the DPRK
발표해 주신
COVID-19
내용들이
response
실제
on the
북한의
DPRK's
보건의료
health
시스템에
system.
어떠한
So
영향을
what Professor
끼치는지에
Shin
대한
shared with us,
부분을
how has it
간략하게 소개를
impacted
드리도록 하겠습니다.
DPRK's health system will be the focus of my presentation.
보면 유엔 제재와 경제 위기
Amidst the
속에서
UN
북한의
sanction
보건의료
and
체계는
economic crisis,
과거의
the
최대
North Korean healthcare
전환국들에서
system, like
공통적으로
many of the
겪었던
post-socialist
만성적인 보건의료
countries,
재정
is
부족으로
witnessing
인해서
a growth of the
비공식
unofficial
보건의료
medical
시장의
market
확대를 경험하고
due to
있습니다.
chronic shortage of
이러한 변화
funding
속에서
for the
코비드
healthcare
19에 대한
sector.
북한의
Against this
보건의료
background, we can
북한의 이런
presume
봉쇄
that the
정책은
lockdown
경제를
measures that
더욱더
North Korea took
위축시키고
to
또
control
비공식 의료
COVID-19 has
시장의
dealt a further blow to the
확대를
economy
경험을 하고
and has an
있습니다.
impact on the healthcare system.
특히 이 북한의 만성적인 보건의료
DPRK's
지원은
chronic shortage of
의료인과
healthcare
관련된
funding has led
월급과
to weakened
배급을 적절하게
control
이루어지지
over
못하게 하였고
medical
이런 부분은
personnel by
결국은
the state
정부의
and the
통제를
growth of
보건의료인에
the
대한
unofficial
통제를
medical market
약화시키면서
and an
비공식
increase
환자
in
부담금이나 또는
self-diagnosis and
비공식
self-treatment with
개인
no
진료,
strong social security net. The
장마당에서의
unofficial
약국에서의
increased
장마당화나
burden
또는
on
개인
patients
약국의
has led
확대와
to a
같은
divide
비공식
in
의료 시장의
medical
확대를
service access
강화하였습니다.
depending on whether
이와
one has
같이
the
사회
means or
안전망이
not to pay for
약화된
the
상태에서
services and
비공식 의료 시장의
medicines.
확대는 북한 주민들의 개인 진료, 또
North
자가 진단,
Korean
자가 치료에 대한
people,
행동을 보이고
because there is
이는
no
빈부에
official
따른 의료에 대한
public
접근성의
healthcare
격차를 강화하는
system,
경향을 보이고 있습니다.
must resort to their own means
물론
to
북한의
procure
사회주의 의료
medicine
시스템이
and also
예방접종이나
healthcare
감염병
services.
방역에 관련된
Currently,
부분에서는
vaccination and prevention and
현재에도
control of
제한적으로
infectious
통제를 잘
diseases under the
작동하고 있습니다.
DPRK
이런 부분들이
socialist medical
추후에
system
코비드-19
is, although
예방접종이
limited,
공급이 됐을
still under
때 이
control.
예방접종률이 높을 수
And
있다는 것을 시사를 하지만
because they
이러한
have a good socialist
지속적인
medical
장기적인
system,
관리가
they
필요한
can
만성질환이나
increase
비감염병
vaccination
질환과 관련된
coverage when there
부분에서는
is
매우
an outbreak. But
취약하고
in terms of
또
chronic
앞으로
disease
우리가
and
유엔 제재와
non-communicable
코비드
disease that
락다운이
demand
지속되는
long-term
상황에서
sustained
북한의 보건의료
treatment,
시스템이 어떠한 영향을 받는지를 이해하는 것이
they are in
추후에
an
교류협력
exceptionally
방안을 고민하는 데
vulnerable
필요하다고 할 수가
state.
있겠습니다.
And so I think we need to understand what impact the UN sanctions and the lockdown has had on the North Korean healthcare system and examine ways to promote exchanges and cooperation.
제가 잠깐 그 언어 설정을 조금 바꿔서 제가 다시 한번 발표를
I'm
하도록
going
하겠습니다.
to change the language setting on my screen right now. So this is the second topic of my presentation, which is trends in global health aid to DPRK during the international sanction and the role of the ROK government in the COVID-19 pandemic era. So we are looking at the financial assistance from the international community to North Korea in terms of their healthcare system. So we have to look at who the donor countries are, what is the channel for providing financial assistance, and then we have to look at how the projects are implemented in North Korea. So for government-led programs and for non-government-led programs, we have to look at how these programs are implemented. The North Korean authorities have a strong hold on how the projects are implemented, so we have to look at the channels. With regard to trends in global health aid to DPRK by channel, if you look at it year by year, you can see where North Korea is dependent on financial assistance. From 2010, you can see a global fund, which helps to fight TB and malaria, has played a key role. And then Gavi, which is in charge of vaccination and immunization programs, you can see has had a key role in terms of development assistance. So in terms of development assistance for the healthcare sector, Gavi and Global Fund account for over 50% of the assistance. So if we look at the accumulated assistance for Global Fund and Gavi, you can see that they take up the lion's share. WFP also provides humanitarian assistance. So in terms of fighting infectious diseases, you could say that Global Fund and Gavi play an important role in ensuring the health security of DPRK. So in order to achieve the Millennium Development Goals, the Global Health Initiatives was formed, and Gavi and Global Fund was launched. And they are closely connected to health security. So for Gavi, they are in charge of the COVID-19 vaccines through COVAX, and the Global Fund, which is in charge of TB, malaria, and AIDS. Global Fund covers about 95% of TB program in North Korea. One thing that we have to look at is that the public donors' contributions cannot be earmarked for specific countries. So when we cannot, the Korean government cannot provide funding to Global Fund or Gavi, specifically earmarking the budget to DPRK. So usually it is not through the Inter-Korean Cooperation Fund, but it is through the Global Disease Eradication Fund of the Ministry of Foreign Affairs that the Korean government provides funding to these organizations. And these organizations also base their financing on performance-based financing. So 2-3 years ago, there was an incident in the international community regarding TB crisis in the DPRK. So the Global Fund actually in 2018 suspended its assistance to the DPRK in terms of their TB program. And Christopher Ben, the Director of External Relations, visits the South Korean government and indirectly called for an increase of Korea's contribution to the Global Fund. And what he was saying was that the amount that South Korea was contributing only amounted to 1/3 of what the Global Fund was sending to DPRK as aid. But in 2018, the ROK government maintained its previous level of contribution. And so the Global Fund suspended its assistance to the DPRK. But in 2019, the ROK government decided to double its contribution. And when COVID-19 pandemic was just starting, in January 2020, Global Fund resumed its support for DPRK's TB and malaria programs. So what this shows us is that if a country is financially dependent on certain external organizations, they become extremely vulnerable to the external environment and political decisions. And I would also like to point out that these examples highlight the important role of donor countries. So for the Ministry of Unification, we have the Inter-Korean Cooperation Fund that provides funding to UN agency. The Ministry of Foreign Affairs has a Global Disease Eradication Fund that indirectly provides assistance to North Korea through Gavi and Global Fund. And so I think in order to continuously support programs in DPRK, the decision and role of ROK government is also very important. Professor SHIN also mentioned that we need to have a significant amount of vaccine support for DPRK in order to open the borders and improve inter-Korean relations. So from 2000 to 2019, if you look at humanitarian assistance to DPRK, and if you look at the donor countries here on this slide, you can see that the US played a very important role. But from 2000 to 2004, the amount provided is the largest amount in comparison to the support that has been provided to now. And you can see that a lot of the support came before the nuclear program crisis broke out in DPRK. So for COVID-19, when we provide support to DPRK, I think that the United States decision and its role is very important. And with close cooperation with Korea and other donor countries, I think that we need to help DPRK overcome the humanitarian crisis right now. And so we can provide them direct and indirect support, for example, providing them with test kits, treatments, and vaccines. So I believe that the decision to provide this humanitarian assistance would be very important. And then the last topic that I would like to talk about is Professor Chin also mentioned this, and I think it ties in with his presentation, is when we think about the post-COVID era, we have to think about how we can create a life health community here on the Korean Peninsula. North Korea also needs to look at economic benefits and industrial benefits through the initiatives that we launched between the two Koreas. So the two Koreas can create a synergy and create a cooperative model. And I think that will actually lead to a CTR reduction. So as a proposal in the healthcare sector, I would like to propose a biomedical cluster cooperation model. One biomedical cluster that we can look toward as a reference point is the Medicon Valley in Sweden and Denmark. So these two countries in the early 1980s, in order to overcome economic crisis, they joined hands to create this biomedical cluster. And this biomedical cluster was created in the border area. So it is today now one of the third largest biomedical clusters around the world. And I think we can apply this model to the border area between the two Koreas or the DMZ. And if we are able to do this, we can create a new model of cooperation. I think this biomedical cluster has a lot of implications for us because in the border area, experts, businesses from the two Koreas will come together to do research and development activity, to produce services and products. So this biomedical cluster could become a sign of cooperation, of horizontal cooperation between the two Koreas. The Minister of Unification actually supported this proposal and this project, and we were able to create this model with the close cooperation of many experts around the world. So we have a y-axis and a x-axis. So here you can see that plants, humans, and animals are on the take up one part of the axis, and also we don't have any boundaries between the two Koreas. So people, animals, and plants come together under one health concept. And then in the x-axis, you can see biomedical, agricultural science, R&D, One Health Hospital, and industrial complex. So this is on the x-axis. So this is the Inter-Korean Biomedical Cluster. So not only life sciences, but we also look at food security. So we would operate an agricultural life research center. And North Korea has strength in developing drugs derived from natural products. So we would cooperate in this area. And we would have an Asia Infectious Disease Response Center. We would have veterinary hospitals, botanical hospitals, plant quarantine centers. And we would also develop relevant technology and equipment, and we would also develop pharmaceuticals and new drugs. through GMP facilities, and we would also look at agriculture industry and different business platforms. So this could be a project that could be carried out in the border area between the two Koreas. So this would really, I believe, support the activities of CTR. It could be an important tool in realizing CTR on the Korean Peninsula. So in order for this model to be materialized, of course, there needs to be an improvement in inter-Korean relations, and we also need to address the sanctions imposed on North Korea. I hope that today's gathering will allow global experts to put their heads together to come up with solutions, and I hope that we will also I hope that we can also examine ways to increase cooperation with North Korea. So with this, I would like to conclude my presentation.
Thank you very much, Professor Park. It was really a very good presentation, and also thank you for thinking out of the box and looking towards Sweden and Denmark to propose a model that could be a possible way for the CTR Plus project to kind of go forward with new ideas. It really was very, very good. Now, we now move on, and I should say that this is the end of the public session, to those of you who joined us like via YouTube or live stream, I should mention that there will be reports that will be put together by APLN, a final workshop report, and that will be published on the APLN website, apln.network. And I would encourage you to look forward to it, because I think it will gather all of the ideas that have been discussed here and brought forward, and I think it'll be very informative. So thank you. So before we now move on with our meetings and the commentators panel and the open floor discussion, we will have a 5-minute break. So we will sign off now for 5 minutes and then come back again in a couple of minutes. But thank you to the 3 presenters who did such a great presentations, and really was extremely insightful. Thank you very much.